Welcome to the Core Experience, your connection to community, business, and the people who make it all happen with your host, Brandon Suba.
Well, hello, everybody, and welcome back to the Core Experience. My name is Brandon Suba, and I am a Treasury Relationship Manager here at Core Bank. But from time to time, I like to work with my buddy Adam here, who is also at the bank. He takes care of our editing, and, we're recording here at the bank today, too. So kind of on the grounds of where sometimes we sneak over to the studio. But we are doing another virtual experience today, so we're going to recognize a little more of the Kansas City area, which we were able to do a show not too long ago where we had one of the nonprofits that we support on. And this is going to be very similar with another nonprofit that we were able to support again with a donation from the bank. So without further ado, it is my honor to introduce to you Birju Solanki. And he is the KC Free Eye Clinic Executive Director and co-founder. And at KC Free Eye Clinic, they help low-income and homeless people in the metro area with access to preventable eye exams and glasses, ensuring that sight-robbing eye diseases and blurry vision don't prevent someone from taking advantage of every opportunity. In the third quarter in November 2022, Core Bank awarded the Kansas City Free Eye Clinic with the Community Impact Award of $5,000. Now, I was able to talk to Birju a little before, and I'll let him kind of share this a little bit too. But this is one of those classic stories of somebody that's very well educated, found a passion, and kind of drove with it and now has found great success in it, which blows my mind because I'm not super well educated and I'm just doing the best I can here. But he is making a huge difference in the world. So, Birju, tell us a little bit about yourself and a little bit about the Free Eye Clinic.
Sure. Hey, thanks, Brandon. That was really kind of you to call me well educated. I was like maybe book smarts. Okay. Got my nose buried in a lot of that a lot of times. So the Kansas City Free Eye Clinic is an organization I founded with a friend of mine from college in 2009. Back then we were, nearly just fresh out of college and volunteering at the free health clinic here in town. And a lot of times the patients who are accessing care at these free health clinics don't know a med student, a doctor from a nurse. And we'd frequently be asked the question, hey, do you know where I can get eye care, dental care? Some of these things we didn't really know about, but eye care is something that my friend and I, kind of had in our network, in our networks with a few eye doctors here in town. And so we asked them if they would help us start a side project to help people get the basic services that I've come to enjoy since the eighth grade. When my folks told me, hey, you can't see the red light that's coming up when we're driving. So that's how it kind of all began. And I ran it as like a volunteer exec director up until about 2015. So 2009 to 2015, didn't know what the heck I was doing. I was just connecting people to a cause that I felt like wasn't being taken care of in Kansas City. There wasn't a lot of eye care options. And, for a lot of folks who are accessing healthcare a little too late, sometimes that's at the ER. A lot of times those eye problems become too expensive or too late to treat. People lose their vision. It's really sad. And I was like, well, we could get ahead of that if we, offer some really basic services that are high impact. So together with the Truman Medical Center, the UMKC ophthalmology clinic, doctors there, and medical students, we would run these pop-up clinics sort of downtown about once a month or so. And they were very well attended. A lot of folks have this need. We finally expanded to our physical clinic space, which is at Hope Faith Ministries and their day center helping the homeless here in town, kind of like near the northeast neighborhood of downtown KCMO. So we have a physical space there now. And we've been there since 2012, basically. It's kind of been a long journey for the last 12 years being in a physical clinic space, but it's very rewarding to have your own space and not set up and tear down, kind of how we were used to.
What do your hours look like? Well, I hate to interrupt you, but what do your hours look like? Because you are in an area where there's many people that need your services often, right?
Hmm. You're very right about that. So our hours for clinic operations now are like people would come in on a walk-in basis Monday, Wednesdays, and Fridays. We've just hired a part-time eye doctor for the first time this year, so that's exciting. And we can offer these regular business hours where people can kind of pop in whenever they need to get care. They don't have to jump through hoops to make an appointment. A lot of our folks are living on the streets. They're homeless, living transitional housing and things like that. So making it easy with just open hours was really important to us. But Monday, Wednesday, Friday, 9 to 2 is our clinic hours. And then Hope Faith, the building we're inside of, closes for the day.
Okay. Okay. And I did interrupt you. So what were you going to finish there? What you were saying?
I think sometimes we sound bigger than we actually are as an organization, but we're just 2 full-time staff and a part-time eye doctor, like I mentioned. So it's me as the exec director. I joke that's the default title you get when you start a nonprofit, and it's opened a lot of doors, a lot of willing doors with donors and funders, to help move the work forward. And then my colleague, she's our clinic manager. Her name is Emily, and she brings like passion for helping people, running a really tight ship, trying to get as many people in the door as possible to help as many people as we possibly can.
So with the part-time eye doctor on staff, that takes care of that need. Being part-time, do you outsource then or refer some people when you don't have them there?
Yeah, we used to have, I'd say we probably have 1,000 requests for services a year.
Wow.
Before we hired our doctor, we were able to serve maybe 300 out of those 1,000. And this is a lot of it's like word of mouth referrals, or people finding us through our website. So we didn't really do any direct marketing to any patients because, we hate saying no to people. We just don't have the capacity. So once we hired the doc this year, I think by the end of this year, we'll probably end up seeing about 700 people, which is really nice to be able to almost, more than double our capacity with just the position itself. Now, if we can't see someone, and there's definitely reasons to come to Case Dry Clinic versus seeing a private practice doctor, or maybe going to America's Best or Walmart Optical, for example. But if people have more complicated eye issues, yeah, we do refer them out to like an ophthalmologist who can treat them for maybe more like ongoing chronic eye disease and things like that.
Are you able to cover that cost or at least offset it for them?
No, we're not in that place yet.
Okay.
I wish we were.
All in due time. All in due time. So what are some of your goals that you have for the rest of this year? As I can't believe I'm saying this because we're already in August.
I know, it's crazy. So 24, we've had to adjust to having more clinics and more patients come through. And so, a lot of times you don't know what you need to adjust to until you're actually piloting, kind of a new program. For us, this kind of felt like we're starting a brand new practice from the ground up. If you can imagine, we have had a lot of volunteer eye doctors, optometrists, typically who would come volunteer as their schedule allowed. We'd have maybe 2 or 3 clinics a month. And so when we hired this doc in March, automatically we were just like, wow, we have a lot more needs. We've got to find a way to schedule more people and pick up phone calls and text people back when their glasses are ready. So it's revealed a lot of kind of like, basic foundational like business needs of how do you serve more people and higher volume as you scale up. But the things I'm most excited about is, we're seeing a lot more folks, right? And now it means that the word of mouth rate that people are finding out about us is even higher. So now we have partners, different organizations across town who would like us to come out to them to set up our pop-up clinics, because we still have the capability for it to bring out portable eye equipment. There's not a lot of places, I don't think anyone really else in town does that. But we specifically bought portable eye equipment so we can go off-site and bring that care directly to schools and other organizations. Sometimes we go to places that have more sensitive populations. So, a few times a year, we'll go out to like a domestic violence shelter because those folks can't travel to our shelter from a number of like safety reasons and things like that. So we'll do that. We'll bring our equipment to schools, and everyone's getting a high quality comprehensive eye exam that's to the best qualities we can set up in a school gym or a classroom or something like that. But I think that's the most exciting part for me is like, yeah, beyond our brick and mortar location where folks can visit. Now we're going out into community, taking our equipment to more places, reaching more people who have the need, and kind of overcoming transportation barriers, and geography barriers and things like that. So I think back to school is coming up, and I think it's a good way for me to plug our school programs. We are targeting a couple low-income schools in the KCMO public school district right now. We did two schools last year that piloted pretty successfully, that were like low-income schools. Parents, caregivers, and school nurses were overjoyed, I think, when we came in to start off those kids right with the tools they needed to succeed. And now it was just really awesome because like you've got a 6-year-old with glasses, and now they know to come to expect clear vision for the rest of their life. And that was maybe the more profound thing to me of like, well, I didn't realize I needed them until 8th grade. And I put them on and I'm like, oh yeah, now I can see this is great. This is high definition. Well, now these kids are starting to expect that, younger and younger. I'm hoping that, preventive eye care is more ingrained into their, being and into their repertoire when they, seek out healthcare as they grow up and things like that. So to me, that's cool. And back to school, we're trying to hit more schools. I think we saw about 100 kids last year through our mobile program, and I want to get 200 by the end of this year.
Well, that's a great goal.
I would answers.
Well, and we talked about this one a little bit, but the significant achievements professionally, I got to say, I think you just named 3 or 4 of them right there. It's huge what you're doing with your on-site and then still going and doing the pop-ups and the word of mouth. My brain went to somebody that can see telling somebody that can't see, go check them out. But it sounds like it's more community word of mouth, schools coming and requesting you because of the wonderful things you did for their schools. And to get as many as you are with your 3-person show right now, I mean, that sounds pretty big to me. So if you think you have any other big achievements, let's share them. But wow, man, you're killing it. You're killing it.
I appreciate you saying that. Thank you. Yeah, I think that is the biggest achievement, right? Is being able to unlock the things that are going to help more people. Yeah, that is exciting. That is very exciting for sure.
So what do you find to be kind of some challenges just in the nonprofit world or even just getting the exposure?
Yeah, I think probably alluded to a few of those earlier. And it's in nonprofit, everything comes from how much funding you have. So the more we want to scale, we stretch ourselves pretty thin. And that's going to happen whether you're running a private, for-profit business or a nonprofit, I think. But our cycles are longer for seeking funding. Like we have to go through fundraisers and funding cycles through grants and things like that. So what our needs are right now may not be met until a few months from now, or several months from now, things like that. So like, for example, I know gosh, it's all fine, great that we're going out in the community right now, but that means we need more humans to do some of the work, to pick up the phone for us and do scheduling, to play coordinator, to collect consent forms from students and parents. It's a lot of more administrative work that has probably gone up, I'd say. Other challenges, yeah, money is tight. So we have to also be really picky and choosy with the org partners we're going to partner with. So right now, if anyone just approaches us, there's a set number of requirements of how many people are you going to meet? Does it fit our target demographics? Does it, what are the kids like? Is this a low income school with a lot of free and reduced lunch program? Mm-hmm. So I'm always kind of making decisions through that lens. I'd love to give everything away for free.
Right.
And there was a time when we did
all
that.
Of us.
Yep. Sustainability is one of those things that's top of mind for everyone at this point. And yeah, as a small org, so just having people's expertise and involvement, who want to share their networks, share what we're doing to folks. That's ultimately what's going to help us.
You said it earlier that you're scaling your business, and I think getting picky is how you scale, right? Yes, everybody wants to save the world and help everybody, but to me, it sounds like you're zeroing in on those that are going to benefit the most from your services so that your time, your efforts, and your money is going to the best cause.
Absolutely.
So speaking of all thank you. All the donor opportunities here. How can our listeners and viewers support KC Free Eye Clinic?
Well, appreciate you asking that question. And for everyone listening, that please support us in the way that you can. I think our website's a great resource in a lot of ways to find our wish list or ways to just donate cash or become a monthly donor if that's what your capacity allows for. As being a small org, I am really proud to say that many of the dollars that we raise for, I hate to use the word overhead or salaries, but many of those are still grant funded, thank goodness. So a lot of the folks who are donating those services being provided to our people are paid for out of donor funds, which is awesome. After that, we've got a couple events coming up. I think our fall signature event, it's the 10th year of this event, and it's called Glimmer. That's November 9th. And then I know Core Bank is going to do a donation drive for us. We have a lot of consumables and things that we use up very fast in our clinic. And so I know I've shared Amazon wish list of items that we could use at the eye clinic. Your really basic things like tissues and gloves and hand sanitizer and wipes. But we also need, new eyeglass cases, reading glasses. A lot of folks will ask, hey, can I donate my pre-owned glasses? We don't take pre-owned glasses. There's drop boxes around the community where you can find places to drop them off. We just want to offer everyone that we see the most durable, highest quality pair of glasses that we can. And we have the means to go to that with a lot of our generous frame donors and things like that. But yeah, if you can go onto our website or visit us at an event, or even to schedule a tour through, at the eye clinic if you're interested in learning more. Follow us on social. We're at KCFEC. Those are ways people can help.
Birju, this has been amazing. You're doing great things, and I wish you the best of luck with everything you got ahead of you.
Okay. Well, Brandon, thank you for having me on. Thank you to Core Bank and everyone who works there for the work you do to give back to the community, giving us not just a monetary donation, but also a platform to spread awareness of the work that we're doing.
And for more information on the Core Experience podcast, go to corebank.com/podcast, or you can always email coreexperience@corebank.com, and we'll always respond. Or if you have ideas or people you'd like on the show, we'd love to hear them. Birju, thank you again for your time today. I truly appreciate it.
Appreciate your time as well. Thank you, Braden.
And for everybody else, we'll talk to you on a future podcast.
Thank you for listening to The Core Experience, your connection to community, business, and the people who make it all happen. For more details, go to corebank.com/podcast or email coreexperience@corebank.com. Brought to you by Core Bank, member FDIC.